Okay, Peter Greenwald.
I direct the Division of Cancer Prevention at the National Cancer Institute. So I'll talk about prevention. And I think you understand we're really talking about reducing risk. It's not 100% prevention. But there's a lot you can do to improve your chances. And it'll be in two parts. One is lifestyle. What you can do, such as avoiding obesity, keeping trim, getting physical activity, limiting alcohol. The other is a newer area, which are medical approaches to prevention. You can draw a rough comparison to the field of cardiology, where if you have a risk factor, high cholesterol, high blood pressure, it can be brought down, maybe with lifestyle, more likely with drugs, and you lower your risk. So I want to touch on both of those. And I'll start with lifestyle. And breast cancer prevention really starts with how your own health habits, whether you keep trim, whether you get regular exercise. These things are over a lifespan. That is, it's good with children, but it's also effective, at least there's some evidence, even starting late, losing weight, getting exercise even as you get older. There's evidence that still is beneficial. With obesity, it's very, very clear that weight gain as an adult increases the risk of postmenopausal breast cancer. There are suggestions about mechanisms. We know that obesity increases estrogen levels. There are inflammatory reactions, and there are probably other things like insulin growth factors coming up. So there are a number of mechanisms that add to the reason that this is true. I mentioned physical activity. One thing I'd like to bring up, because many of the participants may be more able to address this than us medical scientists, and that is what we call the built environment, your community. Can a child walk to school safely? Can you walk to work? Can you, is there physical ed in your school system or not? Do you have it in your workplace, a place where you can conveniently get exercise? Does a child go to a movie and buy the larger size soft drinks are 32 or 40 ounces of sugar water and caffeine? It's quite reasonable, I think, and I think the mayor thinks, to have a 2-cent tax on soft drinks. So these are things that relate to policy, to advocacy, and where we really need your help to put them into place. Another factor related to that is issues related to adherence. It's true in both prevention. I think it's also true in therapy. There are thoughts that stepwise goals may be useful, where you can meet one goal and that motivates you to go to the next goal. Family support, community support are all useful. So I think we'd like your help, not only discussions of the information. There, up till a huge study called the Women's Health Initiative, many women were taking hormone replacement therapy. Almost, in California, for example, it was thought almost the normal thing to do. And then this very large trial was done that showed it made it worse. But I should be clear, because the press is always saying hormone replacement therapy, but it's really when it was the combination of estrogen plus progestin, not just the estrogen alone. It was that combination, Prempo. So when that news came out, many women stopped, or they lowered the dose and shortened the duration, and that was followed by a decline in breast cancer occurrence. So that's another factor. I'll mention one more before I go to the medical approaches, because I get questions often about environmental pollutants and toxic chemicals. It's very hard to give an exact answer. And the problem is we don't really have direct methods to measure trace exposures to these thousands or even 10,000s of chemicals. We know they're there. We know some of them have a chemical structure that resembles estrogens. Probably not good, although an estrogen that's very weak might actually inhibit a stronger estrogen. It could even be a benefit, although I think in general we don't want pollution. We know that these are absorbed. We know they're in the tissues, including breast tissues in trace amounts. So there's this circumstantial evidence. My own belief is we live in a fragile planet. We should do everything we can to limit and decrease contamination. And whether breast cancer is a major factor, maybe somewhat of a factor. Many of these chemicals have never been studied, so we don't have a pure answer. I won't go into the non-modifiable risk factors like the BRCA genes, strong family history, aging. But I think if you have some of these that you probably, it's worth getting counseling or talking to your doctor about them. One other thing that it's come up more recently is that breast density seems to be a risk factor. And one of the research, it's an association, I should say, rather than a risk factor. And one of the research needs is to understand what is underlying that association, so we understand what is it about it. Now I want to just mention the medical approaches. So, and I'll go through mainly a series of studies run by a large network called NSABP, which is a national network of health scientists, physicians. And the same studies were supported by studies in Europe, although they tended not to have quite as large an effect shown, probably because of their design. So first, an early study of using tamoxifen for breast cancer treatment demonstrated that there were half as many new cancers in the opposite breast. That plus other evidence led us to support a trial called the Breast Cancer Prevention Trial of tamoxifen versus placebo in over 13,000 women. And they had the risk of at least a 60-year-old, even though they could have been as young as 35. And that study showed that breast cancer risk was cut in half, a 49% decrease. All of these studies only related to preventing estrogen receptor positive breast cancer, the roughly 70% that ER positive. So one of the research needs is how to address ER negative. While this was going on, there was a study of raloxifene, another SERM, estrogen receptor modulator. And this was a study aimed at seeing if you could slow osteoporosis and fractures. And an observation in that study was that there was a very marked decrease in breast cancer occurrence, over 60%. And so we felt with the NCAB in the lead again, NSABP in the lead again, that there should be a head-to-head comparison. That was a trial known as STAR, a study of tamoxifen and raloxifene. And then in over 19,000 women, it showed both had a great beneficial effect. Raloxifene, and I won't go into, there were some adverse effects that had to blood clots and maybe cataracts. And so raloxifene seemed to have a better profile. But now, in this past year, there's been a follow-up of several more years. And the benefit is maintained. For tamoxifen, it's completely maintained while the number of blood clot problems went down, even though they were low to start out with. Raloxifene, the benefit was retained, but maybe at 78% of the level. So I'll stop there, but I think what we can say definitively is that we have the first generation studies that prove without question that health lifestyle approaches lower your risk, and that we have medical approaches that lower your risk. We may be able to come up with some with fewer side effects, with a better profile that may also help in other diseases like osteoporosis, heart. We don't even know about things like cognitive function, and that it's a strong, important area to pursue. cancer prevention. Thank you.
Thanks.